Imagine enduring fertility surgery without surgical anesthesia, not by choice, but because it was believed you could handle more pain. This is the untold story of Anarcha, Lucy, Betsey, and many unnamed Black women who bore the brunt of medical advancement. Today's video uncovers the chilling reality behind the medical breakthroughs of Marion Sims, father of modern gynecology, a pioneer whose advancements came at a harrowing cost. Delve into the stories of the forgotten women who endured unimaginable suffering to shape modern gynecology. This is a legacy of resilience and a profound question of ethics in the face of innovation. Join us as we explore the fine line between medical genius and moral ambiguity. The story of Dr. Sims and his medical breakthroughs start when he was born in 1813. He went to medical school in Philadelphia and then moved to Alabama in 1839 to start his medical practice. Initially, Sims wasn't interested in women's health issues. He even said he disliked studying the female reproductive system. However, everything changed in 1845. A slave owner asked Sims to help his 18-year-old slave, Anarcha, who had been in labor for 72 hours. Sims managed to deliver the baby, but he found out that Anarcha had developed a severe health problem called a vesicovaginal fistula from the long labor. This condition created a hole between the bladder and the vagina, causing constant leaking, and was both embarrassing and isolating for women. At the time, people thought it couldn't be fixed. Sims started working on finding a cure for Anarcha, performing 30 experimental surgeries over 4 years until he finally succeeded. His success led to more slave owners seeking his help for their slaves with the same condition. Sims came up with a plan where he would buy these patients to perform surgeries on each of them for research, which he saw as beneficial because it meant he always had someone to operate on. Eventually, Sims' work gained recognition, and he opened a clinic in New York for wealthy patients. He became famous and invented the speculum, originally based on a bent spoon, a tool still used by gynecologists today. In 1855, he founded the first hospital for women in the United States in New York City. Sims' work had a lasting impact on the field of gynecology despite the controversial methods he used in his early research. Dr. Sims documented the names of several Black women who were part of his medical experiments, including Anarcha, Lucy, and Betsey, though the names of many others are lost. These women, young mothers with severe health conditions known as fistulas, served as subjects for Sims' experimental surgeries. In one instance, Sims invited around a dozen doctors to observe as he operated on Lucy, a teenager who had recently given birth. Sims noted that all the doctors believed he was close to a major medical breakthrough, and they were eager to watch him perform the surgery. Despite the importance of the procedure, Sims operated on Lucy without any anesthesia, and he described her as enduring the surgery with remarkable courage. The poor girl, on her knees, bore the operation with great heroism and bravery, Sims wrote. However, Lucy suffered terribly, developing a fever shortly after the operation that nearly took her life. It took her months to recover. Between 1845 and 1849, Sims also performed 30 surgeries on Anarcha to treat her fistula, again without the use of anesthesia. Sims invented the speculum, a tool made from a spoon that holds the vagina open during examinations, allowing doctors to use both hands. He first tested this device on Betsey, and he was amazed at the clarity it provided, stating he could see things as no man had ever seen before. Sims' unethical practices extended beyond women to include Black children. He believed African Americans had a lower capacity for feeling and cognition compared to white people, and so he used tools intended for shoemaking to force apart the bones in their skulls for his examinations. Dr. Sims asserted that all the individuals he experimented on, including enslaved women like Anarcha and Betsey, had given their consent. He even promised one slave owner that he wouldn't perform any life-threatening experiments on them. Sims claimed that these women agreed willingly to the tests. However, considering their status as slaves, the notion of their consent is problematic. As property of others, they hardly had the freedom to refuse. Today's medical standards insist on informed consent, something a slave could not realistically provide. Sims conducted these experimental surgeries without using anesthesia, despite using it for his white, paying patients at the Woman's Hospital in New York. He believed, like many doctors of the 19th century, that Black people had a higher tolerance for pain and didn't need painkillers for these extremely painful surgeries. Defenders of Sims point out that anesthesia tech was a new and rare practice in the 1840s in the United States. It wasn't until the 1850s, when Sims moved to New York, that using anesthesia became more widespread. Yet, even when anesthesia became available, Sims chose not to use it for fistula operations, claiming they weren't painful enough to warrant the trouble. When his surgeries resulted in a patient's death, Sims often blamed the sloth and ignorance of the patient's mothers or the midwives, rather than acknowledging any fault in his procedures. Despite the controversy surrounding his methods, Sims didn't see any issues with his practices. The medical experiments conducted by Dr. Sims take on a stark significance when viewed through the lens of historical medical ethics and racial attitudes of the 19th century. During this period, the medical field was burgeoning, and ethical standards were vastly different from today's practices. Sims, operating in an era where the medical community was still grappling with the human implications of their practices, may not have recognized the full ethical dimensions of his actions. Importantly, the prevailing beliefs of the time inaccurately posited that African Americans experienced less pain than their white counterparts, influencing Sims' decision to forego anesthesia. This belief was not isolated to Sims, but was a widespread assumption that affected medical treatment for African Americans across various sectors of healthcare. It's crucial to understand that Sims' decisions occurred within this broader context of systematic racial biases, which skewed scientific objectivity and clinical empathy. Moreover, Sims' ability to perform such experiments was facilitated by the societal structures of the time, which viewed enslaved people as property rather than individuals with rights. This view allowed Sims and others to prioritize medical discovery at a significant human cost. This practice is unequivocally condemned in modern medical ethics, particularly in specialized fields like genetics ethics. The legacy of James Marion Sims is a topic of ongoing debate among modern historians. Some of his defenders claim that Sims was simply acting according to the norms of his era. They argue that he did obtain consent from his patients and was successful in curing them. For example, the American Journal of Obstetrics and Gynecology in 1978 mentioned that Sims' initial patients might have only endured the repeated painful surgeries because they were slaves, but ultimately they had reasons to be thankful to him. In 1981, the Journal of South Carolina Medical Association praised Sims for inventively creating a new surgical procedure as if by magic. Additionally, in 2006, a surgeon from Washington University, Lewis Wall, defended Sims in the Journal of Medical Ethics, describing him as a dedicated doctor working within a slaveholding society. However, Sims' reputation is not without controversy. In the same year Wall defended him, the University of Alabama at Birmingham removed Sims from their Medical Giants of Alabama display. In 2017, controversy over Sims' methods was highlighted when someone vandalized his statue in Central Park, spray painting "racist" on it. Following public outcry for the statue's removal, the journal Nature published an editorial arguing against removing statues of historical figures, suggesting it risks whitewashing history. This stance initially received harsh criticism, leading Nature to revise its position, acknowledging that science must recognize its past mistakes and crimes. As we explore the history of surgical gynecology, it's crucial to honor the real pioneers: Anarcha, Lucy, and Betsey. These remarkable women endured immense suffering under Dr. Sims' experimental procedures, and their resilience significantly contributed to medical advancements. Their stories remind us of our ethical responsibilities and the importance of respecting every individual in medical practices. Let us remember to recognize and honor their vital role in shaping modern medicine.